if I had found edibles or the possibility of edibles, I think that would be the main thing. Learning how to cook, doing edibles to ease a lot of the pain physically that I have been through.
Welcome to the Well with Cannabis podcast, a show dedicated to telling the life-changing stories of those who live well with cannabis, all while teaching you how to do the same. Meet your host, Emily Kyle, a registered dietitian nutritionist turned certified holistic cannabis practitioner. Emily changed her life for the better with the help of the cannabis plant, and now she is committed to helping others do the same. Tune in each week to hear heartwarming stories and gain the knowledge you need to feel connected, inspired, and supported on your own cannabis journey. Whether you're a new cannabis consumer or a lifetime lover, you'll benefit from these uplifting tales of real-life journeys that will show you how you too can live your best life well with cannabis.
Before we jump into today's episode, I wanted to share a note on potentially sensitive content. The episodes on the Well with Cannabis podcast are created for adult audiences only. We will at times cover sensitive topics, including but not limited to suicide, abuse, mental illness, sex, drugs, alcohol, psychedelics, and the obvious use of plant medicine. Explicit language may be used occasionally. Please refrain from watching or listening to the show if you're likely to be offended or adversely impacted by any of these topics. The information on this show is for informational and educational purposes only. It does not constitute medical advice. If any of the content on this podcast has brought up anything for you, please reach out or speak to a professional or someone you trust. Hello, and welcome back to another episode of the Well with Cannabis podcast. I am Emily Kyle here with our friend Cathy. I'm so excited to get into your story and talk all things edibles. Hi, Cathy. How are you?
I'm doing great, Emily. Thank you. Excited to be here.
Thank you so much for coming on and sharing your story. And I'm super intrigued because you've dealt with chronic pain and you're now using cannabis to manage it. And I'd love to explore your story and how you got started here.
Okay. Well, I was injured years ago on a job, and unfortunately it led to surgery on my back. So I have some fusions in my spine. And I used to use cannabis recreationally years ago. And the pain is just, it can be debilitating. And so meds, you can only take so much to where it makes you tired. It messes with your digestive system, a lot of different things, the side effects. And I decided to start doing edibles. And I had never tried edibles before, but I had heard a lot about them. So I was like, okay. So I went to one of the local dispensaries here, and I purchased some items. Some worked really well, and I enjoyed them. They gave me a different feeling from smoking cannabis. It's more of a physical, and it eliminates my pain. It helps me to sleep better at night. I also deal with arthritis, so I have it really bad in my hands, and that helps. It helps with the inflammation, the pain, just being able to do things that normally it'd be like, okay, well, I got to wait till that mellows out, And so I have found a positive way to use cannabis in my life.
I'm so happy for you. I mean, pain relief, everybody deserves that, and everybody deserves to feel better. Did you have a transition time where you transitioned from pharmaceuticals into cannabis, or how did that evolve for you?
I was doing a combination starting out because I didn't know how cannabis would be, I mean, you got to learn your dosage for one. You can't just jump into it and eat the whole thing and go, oh, I'll be fine. You got to take it in small bites, literally, to see how your body would respond and to see how well it works with your body and the different types of cannabis as well, because each one does a little bit different. So that's where I got started. I started with a brownie bite, and they're like Cathy, and I can't remember the name of them, but I recognize them when I see them. I was like,
Yeah.
oh, that's the one, you know. But the brownie, it. The reason why I started making my own is because the brownie that I ate, it worked kind of, but it was more like cardboard. And so I was looking more for flavor
Yeah.
and, but also have it work as well,
Right.
you know. So I started my journey of making my own.
That's so
So
exciting.
it is. And I've looked at your website and I have you on my email, and you've been a big help. And there's another
Oh,
person that I look at on YouTube as well. So in between the two of you, I've started ordering books on cannabis, you know, different cookbooks, experimenting. And so that's where I'm at this point.
that is so exciting. And that's really, I mean, that's a brave step to get ready and experiment. What made you say, let me step out of my comfort zone of the dispensary and move into the world of edibles at home, I should say.
One, I can control what goes in it. I know where the product comes from, and then I can adjust it to my taste as well. So it's a combination of things. I can adjust the dosage because sometimes I might need something a little bit stronger
Yeah.
and sometimes not so strong. And what you buy at a dispensary, it's hard to tell exactly, okay, is this exactly what I need or want? You know? And
Yep.
so I decided to start doing my own thing, and I am educating myself, and I'm getting ready to take a class soon about all the cannabis parts, you know, everything else, tried and true recipes from a world renowned chef that has done it for years.
That's so
So
exciting.
I am so excited. I can't wait to do the class. You know, it's going to be, going back to school is going to be a little bit different, you know. And
Yes.
the subject, some people get real touchy about it, I've noticed. And so I'm careful who I talk to about it,
Yeah.
you know.
Yeah. It's
Um,
definitely reading the room a little bit and seeing how people react.
yes, definitely. And I've had a few requests, you know, to make things for
Ooh,
certain people.
that's
And so
exciting.
it is. And I have got a lot of rave reviews from the people I have helped. Well,
Isn't that
it
such a
helps.
good feeling to like help someone else like get out of pain or find that relief? Like it's such a, for me anyway, I'm like, wow, like when I worked in the hospital as a dietitian, I never felt like I helped anyone. And now with
Oh, wow.
cannabis, I feel like I'm actually helping people. And with your products, like you're helping real people. It's so exciting.
Yes, it is, because you know you're helping them and giving them relief,
Yes.
because pain, like I said, is very debilitating, and people don't realize how much it affects everything in your life.
Yes.
Not just the physical, but your relationships, your thought
Mhm.
process, you know, your choices. So being able to learn from you and the other one, like I was saying, it has helped me tremendously.
I'm so happy. And I'm so glad that you were brave enough to say, I'm going to explore this and give it a try. Was there anything that pushed you towards cannabis specifically?
It's more natural. It's not a pharmaceutical drug. It doesn't have the side effects that a drug would. And so I like that. You know, when someone's already dealing with so many things, you try and eliminate certain things to make your quality of life better. And with this being a natural product, it makes a big difference, I believe, you know. And so I think that, you know, there's still, of course, the stigma to it. Oh, people just want to smoke to get high, or you want to eat to get high. And that's not always the truth.
In most cases, it's actually not the truth. And everybody that I've talked to, they echo the same message. I'm not here to get high. Not that there's anything wrong with getting high, because if you enjoy it, go for it. But everybody's intention is to feel better. And I'm so glad we have these conversations to continue to squash that stereotype, because it's just so false.
It's very much needed. I agree. And I think the more education and understanding people have, the more they'll be like, stop and think and go, well, maybe I've been looking at this wrong, and maybe this can help people, with depression and this type of thing. And they start seeing things differently, because I believe that it can help people with depression and anxiety and pain and other issues that they might have. They've been using cannabis for cancer patients for how long? To get them to eat.
Yes. Make them feel better, bring them comfort.
Yes. Yes.
And everybody deserves that. Everybody deserves pain relief and comfort and relaxation. Sometimes it makes me so sad that not everybody has access to this plant, because fundamentally it feels like a human right. Like we all should have access to the plant freely.
I agree. They legalized it about 2 years, I think, ago in Alaska.
Oh my gosh, yay.
It's nice because we don't have to worry about, trying to get it and, be quiet about it. We can just literally go to the dispensary and get it legally.
Isn't that such a crazy feeling? Do you remember what your first dispensary trip was like?
Yes.
Tell me about it.
I went with my husband, and it was interesting because, of course, you have to show your ID, to show that you're of legal age. And we got there, and he knows a lot more about it than I do. So I'm also learning from him as well. And he's like, okay. And I was asking him questions, and, he was showing me different products, knowing that I prefer edibles. And he introduced me to a lemonade, and he can drink the whole bottle, no problem. I take it and I'll sip on it. I'll take a little bit at night before I go to bed, put the rest in the fridge, And he goes, you're a lightweight. And I said, that's okay. I don't mind being a lightweight, So
that sounds so exciting, because I have not seen products like that available here in New York. For someone to hear that you could get a lemonade it's so exciting.
Oh, yes, they have lots of new products out up here. Lemonade, there's tinctures, there's ointments, that you can use. There's taffy and brownies and cookies. And, my thought process, I would like to get it more towards savory things, or like granola, different things that you don't see in the market.
Yes.
And eventually I would like to be at that point to where some of these things I could market. Butter is very common, and I've got a gallon jar of it in my fridge, and it's yes. And I was cooking with it one day, and I asked my husband, I said, well, what do you think? And he goes, it tastes really good. And I said, well, I used some of the canna butter in it. He's like, no wonder it tastes so good, And I was experimenting one day, and I decided to make fudge with canna butter.
Yeah.
And unfortunately, I have an issue with my one arm, so I couldn't beat it to the thickness it needed to lose that gloss.
Yeah.
So I converted it to an ice cream topping. So I had already made brownie bites for New Year's Eve. And so we had some remaining. And he had come home seeing me eat this one night. I had taken a couple brownie bites, and then some vanilla bean ice cream, and then some of the canna fudge topping. And I was eating. He goes, I want to try some. I said, do you want me to make you some now? He goes, no, I just ate. He said, let's wait till tomorrow. So I was like, okay. So he got home the next night and I was like, you ready for your dessert? And he's like, yes. I said, okay. So I asked him how many brownies he wanted, how much ice cream. I got it exactly the way he liked it. He sat down and he was eating it, and he only had about 4 bites in, maybe 5. And he goes, I'm getting high already. And he cleared the bowl and he said, babe, that was awesome.
Oh.
He said, that fudge topping, oh my goodness, with the brownies and the ice cream. Yes. And I gave a friend of mine some of the fudge topping and he loved it. He was like, that is so good. So I'm experimenting with things and finding different things to do besides just the brownies that everybody wants and talks about, I consider that a staple.
Yes. Yeah.
So I like to find ulterior substances that I can use with the cannabis, and create something new. And I think the more we experiment with cannabis, the more we're going to find products that is not always sweets.
Yes. Yeah.
Because there's a lot of people out here with type 1, type 2 diabetes or pre-diabetic, which it makes it harder for them with the sugars and that type of thing.
Yeah.
And so I'm looking to infuse maple syrup because I want to use that on my granola.
Yeah. Yum.
So, and another one is honey, which it's coming out now, infused honey. I have
so nice.
Have you tried it?
I haven't. I mean, aside from making it at home, I've never seen it available for purchase.
Oh, yes. We have it up here. A friend of mine gave me some. She had bought it and I ate it straight out of the tube.
The best way to do it.
And then I made some tea for my husband with the rest, and it was just a small tube. It wasn't nothing, big, but he liked it too, and he said, that's different,
It is so nice. And I'm so glad you mentioned about experimenting, because so much of cannabis is experimenting, whether it be different dosages, different strains, or just different recipes. And I feel like it can really blossom into this new hobby for a lot of people that is really enjoyable. Do you find that?
I do. I enjoy baking and cooking. That is my happy place, I guess you could say.
Yes.
So I love to get in the kitchen and try new things or put a spin on something that is a staple in our life to give a little bit of difference, make it a little different, change it up some, and my husband doesn't cook because he's like, I like what you do. Even if I'm cooking something quick and it's a package item, I always do something different to it. So it makes it more homemade.
Yeah. Yeah.
And
man, your husband's got to be a happy, happy man that you have found cannabis and are now cooking all of these amazing things at home.
He is. He loves it. My next one, I have just started doing sourdough. So I'm trying to figure out a way to do sourdough with cannabis.
Oh my gosh. How are you envisioning that? I've never made bread before, so I don't even know what goes into it.
Oh, I've been making bread for years and everybody loves my banana bread, but that would be too easy because it requires butter.
Yeah.
So with the cannabis, I'm looking more at an oil.
Yeah. Okay.
And I had infused 2 different oils about 6 months ago. And I had put some straight cannabis into the jar with oil. And then one I added garlic to. And then what I did was I decarbonized some cannabis as well. And I did that in an oil. And then I mix the two and I let them
Perfect.
sit.
Perfect.
And so I would rotate them. And of course,
Mm-hmm.
you can't keep all of the oils mixed in all the time. And so
Right.
they get along the jar. So you got to shake it and warm it up.
Yep.
But it is totally different. I'm hoping to use those oils in the sourdough bread because you need oils.
Oh, that would be perfect.
So that's my goal. I just haven't had the time recently to take it because it's a day-long process, basically.
Yes. It's a labor of love, isn't it?
It is. I believe when you cook for someone, you show the love,
Yeah.
the caring that you have for people. And people, if they stop and look at it, we connect when we break bread together, and it can be your friends, your family, and it can be a business as well, which is where I'm hoping to go into with it. And I'm really excited about this because it's opened a whole new world for cooking.
That is so exciting. I mean, when you make a meal for someone, infused or not, you're sharing and showing your love. But then to add the cannabis component on top of it, and you're adding in healing and well-being, it just is the perfect marriage.
It is. And I just recently found a place where I can get cannabis raw for CBD. And so that is something I am going to be exploring more. I'm excited about it because CBD helps me physically as well. And so I would like to get to the point to where my business, when I start really growing it, I can do the cannabis and then tone it down with the CBD.
Oh, that is perfect. And that's so good to mention too, because a lot of people assume it's just THC, 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 but there's CBD and there's so many other cannabinoids. And just because they don't quote unquote make us high doesn't mean they can't make us feel well in other situations. Right. What do you like to use CBD for?
It helps with the arthritis in my body and the pain. Okay. And so cannabis is great. It's more than just a high, like you said.
Yeah.
It helps so much in your body that when you're taking it, you feel great. And it's like, wow, this is amazing. I haven't felt this good in I don't know how long,
Yes.
And then if you run out of the CBD, which I have done, and it's like, why am I hurting so much? What is going on here?
Yeah.
And it's because I ran out, and it's like, oh yeah, you forgot to go to the store and get the tincture. Yeah. So I would like to produce my own, and that's why I had looked into finding the CBD raw, just the CBD, and making my own tinctures. And so I can have it on hand all the time and eventually, help others. I've got a friend, she uses CBD, and she's the one that introduced me to the CBD.
Oh, nice. How did that happen?
She has back issues as well. She had fractured one of her vertebrae in her back, and it's healed, but it still causes trouble sometimes and stuff. So we had gone for coffee, and there's this place up here that does the CBD in the coffee.
See, we're not allowed to have that in New York. That's so exciting.
Really? Wow. Yeah, it was great. She goes, I'm going to take you to get coffee, because I was hurting really bad that day, wintertime and stuff. And I was like, okay, so we went and got coffee, and she told them how much she wanted in each cup. They were like, no problem. Awesome. And I started drinking it. It was like, oh, wow, this is amazing. And so I learned something new that day, was introduced to a new product, but being able to blend it with something else. And I could drink it while I'm out. Yeah. I don't like to eat edibles and be driving. Right. I prefer to stay home, be safe,
Yep.
And the CBD I can take without having that
Yeah.
worry,
Yep.
and
Mm-hmm.
so it makes a big difference.
Oh, I'm so glad you said that. And I just cannot wait. I'm sure there are so many people listening be like, I cannot wait for the day I can walk into a coffee shop and have them put cannabis or CBD oil in my coffee. I just can't believe that that's a real thing. It makes me so happy to see that.
Oh yeah, well you can do it at home.
I know, but there's something special about like going out with a friend and like a friend
That's true.
introducing you. Imagine how easy it would be for people to be introduced to cannabis if a friend could just take them on a coffee date and introduce them and order for
Yes.
them. It sounds so like romantic in like not a romantic way, but like what a
Right.
great way to introduce someone to cannabis. It's safe, it's comfortable, you're with a friend. Like it sounds so nice.
It was. And, I hope more people realize that just because it comes from cannabis does not mean it's a bad thing.
Right.
It doesn't make you high. It doesn't give you that body high or mental high. It helps ease the pain. And, I love CBD. And you can get it in, cream forms or ointment forms now too, as well. And a lot of people don't realize that, so I hope, from this podcast and others that I know you're doing, I hope others realize, there's more to cannabis than just a recreational high.
Yeah.
And our society needs it. The pharma companies are poisoning us with the meds.
Yeah.
And occasionally I still have to take them, but I limit myself,
Right. And there's no shame if you need to take one, you need to take one. If it
Right.
makes you feel better, I'm all for that always.
Right. And I mean, who can go to work,
Right.
and be doing edibles? I mean, I wouldn't be able to concentrate, to be honest with you,
Right.
And so the CBD and of course the pharmaceuticals, they all have their place,
Yes. Yep.
but I think the more people realize there's a natural product out there,
Yeah.
I think it would make a big difference in their life, their thought process, and how they feel. And that's the main thing. How does it make you feel? And
especially when we're all, we live in a crazy world. Like we can all use as much happiness and relaxation and calmness as we can get, and if people are feeling like they can't find those things and cannabis could be an answer, I really hope people really give it a chance because it's made a difference for me. It's made a difference for you. And I mean, we're just regular, real people trying to show everyone else that there is a really great alternative out there.
Definitely. Now, what differences do you see in between smoking cannabis and edibles? I mean, you've got experience with it.
Yeah.
And so I would like to hear your point of view and your journey.
Yeah. So I will preference to say, like, I love smoking. It is my favorite avenue. And I think that stems from when I first started using cannabis over 10 years ago. That's all there was. I didn't know anything about edibles, really. It was just you roll a joint, you smoke a pipe, that's it. And so that was always my first and only introduction to cannabis. And then as I've learned and as I become a mom, I really wanted to smoke less because I hate smelling like it. Like my thing is smelling like it. It's always bothered me because I don't want people to smell me. I don't want my kids to smell me. I would like tip people off that I could be a cannabis consumer. And so everything that I've learned, like from an education standpoint, is that smoking The reason people love it, the reason I love it is because it's instantaneous. You get that relief in like 1 to 3 minutes. And so I always tell people, like, if you are in immediate pain and you need immediate relief or immediate anxiety, smoking might be an alternative because it works really fast.
Right.
Now, on the other side, it doesn't last as long as edibles. So depending on how much you use, it could be like 1 to 3 hours. So some people might find that they have to smoke more. And then, of course, with smoking, we have all of the drawbacks of actually smoking. You know, a lot of people really have a hard time with smoking because smoking's not healthy. And if we're incorporating cannabis, the goal is health. And so how do we intersect that? And thankfully, someone came up with like the most genius, perfect solution. Have you heard of a dry herb vaporizer?
Yes.
That for me has been like the perfect medium of, okay, you can have your cake and eat it too. You can have that instantaneous relief without having to worry about the negatives associated with smoking. And so I've played around with a couple of different devices. There's tons out there. And I think that anyone listening has to know that there's like a little learning curve. You have to be patient and willing to work with it. But once you figure it out, for me, I hardly smoke at all anymore unless it's like a social thing. But at home, like I can use my dry herb vaporizer. Doesn't smell. I don't have to worry so much about my kids. I can still smoke, but I have fallen in love with edibles. So once, they came on the scene and at first I was like, I don't like edibles because I didn't know my dosage and I was always really nervous about it. And once there were actual products with like dosages on them, not just like a baggie from a friend with a random brownie inside. Once I was like, okay, I know if I take this has 5 milligrams, I could track my dose and understand what my body needed. And I think for me, that was most helpful in knowing. So now I'm like, okay, I know I can handle 12 milligrams, no problem. But I still to this day am very hesitant to try even my own homemade edibles because the dosing I find the hardest, trickiest part. Have you experienced that as well?
Yes. And when I make something, I make small bite size.
Yeah. Yes.
And I test it that way. That's the best you can do until you can figure out, okay, if you make your recipe the same every time, and then you take individual small bite size, not a big bite size. Now, my husband always wants a big bite size, and I'm like a third of what he does.
Yes.
But until you get the idea and understanding of what your body needs, and how much you can take and stay in that parameter, then you're good. But until that point, you have to experiment and find out, okay, where am I at? Because one dosage for you might not be enough for me or vice versa.
Exactly. What works for your friend isn't going to work for you.
Exactly. Yes, because we're all different. All of our chemistry is different. And so if we know what's in the product and how much is in there, and then we make smaller doses by smaller bites, I like to call them bites, because some people look at a bite of brownie and it's like, for me, it would be 2 or 3 bites.
Yeah.
So, and that's where a lot of people make the mistake with edibles. They consume the whole thing and then it's too much. And that's not safe. And that's why
it doesn't feel good. It doesn't.
No. Yeah, I mean, you feel sick. Some people, end up
have
with
anxiety
nausea.
attacks. Yeah. It definitely is not an experience I am ever trying for. That's for sure.
Yeah, no. I prefer to be mellow and feeling good.
Yes, exactly. And that's why I'm so glad that you brought this up, because starting with a bite-size bite is the right thing to do. Like always starting small, because you can always take another bite, but you can't untake that bite.
Right. And you need to give time to let it affect you. Like I knew somebody that had a brownie and it was a regular size brownie. I said, do not eat the whole thing. Take a little bit off, eat it, wait a half hour or so, 45 minutes, an hour, depending on your body, see how it goes, and my concern is their safety.
Yeah. Yep.
And not being sick. I want them to feel good, and
Exactly.
know that they're safe.
Yeah.
Because when they don't do it properly, a lot of people tend to panic and they don't feel safe.
Yeah. It's true. And it's like you hear all these like news stories of rises in ER after cannabis has been legalized. And it's like, it's just the people eating too much edibles and having a really hard reaction to it, and you're not going to die, but in the moment it actually does feel like you're going to die. And the whole goal of education and using cannabis responsibly is teaching people, if you're going to try this, like, you can do it responsibly. You don't have to eat the whole thing. Like, I'm so glad you're saying this, because that's how we act as responsible cannabis consumers.
That's right. And people need to understand, it may taste good, and well, most times it does taste good, and that's why you want to eat more. But just because you want to eat more doesn't make it act faster.
Right. And I mean, we're all so different. So I mentioned I like smoking because it works fast, whereas edibles will take much longer to take effect. So, but it's still different for everyone. It could take 30 minutes. It could take 2 hours. It can depend on your digestive system, what you've eaten for the day, other medications. Yes. And so with edibles, like, it really is about patience. And I know that's hard for people, because I find a lot of times people still have like that pharma mindset where they're like, just give me the pill, give me the solution, give me the single dose.
Now.
And they're not used to having to experiment and be patient. And that feels awkward for people. But I like to assure people that's the journey.
Yes. And, I was watching a show about chefs that use cannabis in their cooking. And I'm not going to name it, but they were doing a contest. And the chef had to put so much in, they had to let them know what was in there, the host and the hostess. And then they had a panel of people that they invited to try it out. And they were talking about, don't eat everything. If you're not used to it, take small bites. And they didn't serve massive amounts. When they did it, they would do smaller bites, and say, hey, there's 3 grams in there total. So if you're not used to it, take only a bite, see how it goes. And I mean, they even talked about it on the show. And so people need to be aware that we're not doing this to tell you what to do. We're telling you this for your own safety,
and
your own well-being.
I feel like we're trying to share wisdom with others. I feel like our parents, most of them, teach us how to drink responsibly, but we don't really have anyone to teach us how to use cannabis responsibly. And so it's kind of like a PSA, like woman to woman or adult to adult, like, hello, we're just trying to help you. Like you said, we're not trying to tell anybody what to do, but just offer like that guidance and reassurance. And I think for a lot of people who are scared to take edibles might actually just love this conversation, because they know that they can baby step it, and that's the right thing to do.
And that's how I did it. I baby stepped. Perfect. Because you got to have a healthy fear of knowing what your body can handle. And I mean, that's with anything, even pharmaceuticals. So if they're like, okay, a cancer patient, they don't automatically put them on 50 milligrams of morphine.
Right.
They small dose it until they find out what works.
Yes.
Cannabis is the same way. You have to have a healthy respect for the plant and what it can do for you. And that is what people don't think about, unfortunately.
Well, I'm
There,
hoping, I mean, these are great, wise words. I'm hoping people listening on the other side are going to be like, oh, well, like no one's explained it to me like that before. Like, but this is great. I feel like this is the best advice for anybody listening who has wanted to try edibles, but has been
yes.
not ready to. Like, I feel like this will give someone the confidence needed to be like, oh, okay. If Cathy can do it, I can do it.
Yes, definitely. And I'm glad that I was able to share that with you. And I'm glad you understand what I'm talking about.
Oh, absolutely. And I have a feeling a lot of people are going to listen to this and be like, oh, my hope is that someone out there who maybe hasn't tried cannabis before is going to listen to Cathy and be like, wow, she didn't do cannabis before and I don't want to smoke, but I could try an edible. And she just told me how to safely do it. Like, it's perfect.
Yes.
It's a win-win because I feel like anyone who uses cannabis and feels so much better, they just want to help someone else. And by sharing your experience and your story, you are helping other people. So thank you so much.
Oh, you were so welcome. And I wanted to put out there, I am in my late 50s. I am not a young girl running around doing this. So I wanted to break the age barrier for women or men that are older. You can use cannabis and you can use it safely, and give it a shot, because during my time frame, my era, it was taboo for a lot of years. And, we were always told, oh, well, if you're doing that, you're bad. You're on the wrong side of the track, so to speak. And it's not bad. It's a plant. You have to use your brain, when you're starting out. Use your common sense. Just because I'm of an age, as they say, doesn't mean that you won't get relief from it. Just do it responsibly. Try it. It might work for you. And if you try it and it didn't, well, go back to what you were doing before. I'm sorry it didn't work for you, but open yourself up to it. Think about it. Check it out. Do a little reading. Educate yourself, and I don't want people my age to be afraid of using cannabis for pain, for arthritis, for, anxiety, depression, whatever the case may be. Younger people are more open most times, but a lot of people my age are somewhat closed off.
Mm-hmm.
And I'm hoping this helps them to understand that it's not just the younger generation that can get some relief. They could get some relief as well.
Oh, I'm so glad you shared that, because our older generation, I'm finding, are the ones that are most in need of cannabis, most interested in cannabis, and most ready to use cannabis. So I hope your words echo out into the ears of anybody who is of a certain generation who is kind of, waiting. I think those are the best words you can offer them. Just give it a try and see what happens.
Yes, just start off small, please.
There you go. Yes. Now, I want to be respectful of your time before we go. I ask all my guests the same 4 questions. Are you ready for them?
Yes, ma'am.
All right. Today in your life, what are you most proud of?
I think raising my kids alone.
Oh, gosh, it's hard enough to do it with a helper. Doing it alone, hats off to you.
And them understanding what I'm doing now.
Are they supportive?
Yes, very much so.
I'm so happy to hear that.
So, and they, they are into cannabis. They have smoked it. They have tried edibles, and they understand what I'm going through physically, and they said, Mom, just be safe. Like you tell us, be safe. They are behind it 100%. And actually, my son will be handling my website when I get it up.
Yay.
My daughter wants to come home and help be a part of the business. So I'm hoping that'll work out in the next year or so.
Oh my
And my
gosh.
husband, of course, supports me. I've got some friends that support me. And so the journey with my children and having open communication about everything, including cannabis.
That is beautiful. Oh my gosh. Like this plant bringing like your whole family together, and the future looks so exciting for you. I'm so happy to hear this.
Thank you. I am excited.
So I guess on the opposite side of that, the next question is, what would your life look like if you didn't have cannabis?
Oh my goodness. Restrictive movements, a lot of pain with the infusions, with the fusions in my back, my arthritis. I've had a knee replaced. I played a lot of ball growing up and blew out my knee, so I had to get it replaced. I would be dealing with a lot of pain, a lot of limitations on my life. I'm more active knowing I have relief
Yeah.
than if I didn't. And the medication, pharma medication, can cause depression and, just not wanting to be around people. Pain already makes you tired. And the medication can make you doubly tired. So I prefer to limit that as much as possible and use something more natural, cannabis, CBD at home, and be able to function and get some relief from that pain.
Oh my God, I'm so glad you found cannabis. I mean, I just am so happy for you. If you
Thank
could
you.
go back 10, 20, 30 years ago and give yourself just a little piece of cannabis advice, what would it be?
I would tell myself to change and start using it in my cooking. Unlike you, when I had children, I quit smoking cannabis because you want the best for your children. You want them, healthy. And I mean, it's there, but there's time for that down the road.
Yeah.
And it wasn't regulated back then either. So, that's a big thing to me. If I had found edibles or the possibility of edibles, I think that would be the main thing. Learning how to cook, doing edibles to ease a lot of the pain physically that I have been through.
I'm so glad you found cannabis when you did. A lot of us, I always ask this question, we look back, but hindsight is always 20/20, and path always leads us to where we're supposed to be. Our last question, and I'd love for you to tie this in with your new business and talk a little bit about that, but what would you like to most be remembered for in the cannabis space?
I would like to be remembered, I don't want to say mature, but as someone from another generation that has opened their mind to what cannabis can do, what cannabis can do for everyone if they open their mind to it. And of course, educate themselves. That's priority. You have to educate yourself. Don't just go out there and do it. But I hope to leave a legacy of edibles and, the thought that you can experiment, take a chance, not just with edibles, but different types of recipes, different products to use the cannabis with, and find out what works for you. Because that's how I'm basing my edibles off of. And right now, I am just doing it by word of mouth. People that ask me, hey, do you have some butter? Or would you make me some brownies,
Yeah.
Or even asking me, what do you do with your cannabis? How do you incorporate it? And the oil is a basic, the butter is a basic. To me, the brownies are a basic. They've been around forever.
Mm-hmm.
But like the ice cream, the fudge for the ice cream, I don't know of anybody that's done that. Nobody's done the granola that I know of. So these are things that I want everybody to realize they can do.
Yeah.
Explore, experiment, but just be safe with it.
So perfect advice as we wrap up this conversation. Thank you so much for sharing your wisdom. I hope that people listen and are like, "Ooh, I cannot wait to try edibles." Any last words of advice, wisdom, any other information to share?
My name for my business is Cannabis Edibles. Keep an eye out for it. We're coming.
So when you get your website up and running, let me know and I will link it so anybody who listens to this podcast episode can find you and I'm going to need some fudge for my ice cream in the future.
Okay.
I'm literally been thinking about it this whole interview of oh, it sounds so amazing. So anybody who wants to keep up with you, I'll make sure to get your information in there so they can stay in touch.
Emily, thank you so much for everything today. It has been a joy and my pleasure to sit and talk with you this time.
Thank you so much for sharing your wisdom and your experience. I know everyone is going to love this episode. Thank you, Cathy. Have a wonderful day.
You as well, and thank you for sharing as well.
Thank you.
Congratulations. You've finished another episode of the Well with Cannabis podcast and are one step closer to discovering how you too can live well with cannabis. Thank you for listening in today. We hope this episode has been a helpful and informative one. Please visit emilykylenutrition.com for more information on today's show notes, guest information, recipes, and other resources. If you want more support and encouragement on your cannabis journey, please consider joining the private Well with Cannabis community. In this group, you can connect with like-minded individuals focused on improving their health and wellness through cannabis. Join the group today to continue your journey of wellness together at emilykylenutrition.com.